Good afternoon. My name is Maria Noesi, and I'm the Director of Marketing here at Cognito. I am delighted to welcome you to today's webinar, COVID-19 and School Mental Health, Heading Back to School. Thank you for joining us. This is the third webinar in our series. Before we begin today's presentation, I would like to go over a few housekeeping items. First, the presentation will be recorded. A copy of the presentation and the slides will be sent to you within the next 24 hours, so don't worry about taking any notes. Next, as an attendee, you are in listen-only mode. However, please use the question box in the GoToWebinar interface to submit your questions. We've dedicated time at the end where our presenters will will answer as many questions as possible. Finally, for those of you who are on social media, please connect with us via Twitter using the Cognito handle or the hashtag CognitoWebinars. And you can also sign up for any upcoming webinars or view our on-demand library by visiting cognito.com/webinars. Before I hand it over to our panel, I also have a poll question that I'd like to launch to all of you on the line. So if you can just come back to your screen and share with us, how prepared is your district to support student mental health as school starts to reopen? Are you very prepared? You have your plan in place? Somewhat prepared, you're in the process of creating your plan. Unprepared, you have not started planning. Perhaps you're still reacting to what's currently happening in your district, or you're not sure. And as you answer the poll question, please also use the question box to share with us what are some of your biggest concerns as you look towards the upcoming academic year. I'm going to give you 1 or 2 more seconds. All right, so it looks like the majority of you, 54%, are somewhat prepared. You're currently in the process. 22% are under the unprepared category. You have not started. 21% not sure, and only 2% are very prepared. So we hope that you find today's presentation and discussion very valuable as you continue to evolve your plans for the upcoming school year. So with that, I want to hand it over to my colleague, Jennifer Spiegler, to take us off into our discussion. Jennifer.
Thank you, Maria, and thanks to everybody on the line who's taking time today to join us. I'm Jennifer Spiegler. I'm the Senior Vice President of Strategic Partnerships at Cognito, where I've had the honor and the pleasure of leading our work in the K-12 space for the last 10 plus years. I came to Cognito with a background in instructional design and strategic communications, and I bring to Cognito a deep desire to bring effective technology to scale and have that be something that does good in the world. I think we've done that over the past 10 years. And as a side note, I am just ending my tenure of 13 years as a public school parent. So joining any of those of you who have graduates this spring, I think one of our panelists is in that boat with me. So about Cognito, for those of you who don't already know Cognito, we are a health simulation company that believes in the power of conversation to change lives. Using our simulations, we've been able to empower hundreds of thousands of educators and students to take effective action that supports school climate, safety, and well-being. Our growing portfolio of programs addresses mental health, trauma, suicide, and bullying prevention, and it features practice conversation that help build skills and self-confidence that lead to more frequent and effective conversations in real life. Our evidence-based simulations can be delivered alone or as part of a blended learning workshop that can be conducted either in person or fully online. That's important in these remote times. And if you're looking for remote PD or curriculum in these areas, I do encourage you to sign up for a demo at cognito.com. Next slide, please. I have to say that one of the great perks of my work is that it brings me into conversation with some of the smartest and most dedicated people in the country doing the work of supporting students and families. And today, I am very honored to bring to you voices from across the country and insights from some of our most visionary Cognito partners. Two of these folks are with us on today's panel. First, Dr. Jamie Freeney is a dedicated public health practitioner with a desire to make a difference for the health and well-being of children and adolescents. She earned her doctorate from the University of Texas School of Public Health, and her areas of research include adverse childhood experiences, adolescent mental health, trauma-informed care, and collaborative engagement. Dr. Freeney currently serves as the director of the Center for School Behavioral Health at Mental Health America of Greater Houston, which works collaboratively with school districts, public and nonprofit child-serving organizations, institutions of higher learning, and community stakeholders to develop and implement equitable projects and policies that promote the well-being of school-aged children. Very important work in this time, and I'll just note that we have been working alongside Jamie and the center for several years, most recently delivering trauma training for educators as part of helping schools deliver helping schools respond to Hurricane Harvey, a trauma that is now compounded, obviously, in Houston by not only the pandemic, but the disruption and dislocation of the energy sector in this country. In addition to Dr. Freeney, we're joined by Dr. Shashank Joshi, psychiatrist and professor in the Department of Psychiatry and Behavioral Sciences. Uh-oh, I'm having an audio problem here. Do you hear me? Thumbs up? Okay, I guess it's okay. I'm getting a little feedback. Dr. Joshi is professor in the Department of Psychiatry and Behavioral Sciences, Child and Adolescent Psychiatry and Child Development at Stanford University. He also serves on many advisory boards, including the JED Foundation, the National Center for School Mental Health, and the American Academy of Pediatrics. He the recipient of many honors and awards for mentorship in the field of child and adolescent psychiatry, as well as an engaged leader nationally at the state level in California, where he serves on the Student Mental Health Policy Work Group, and in his county as part of the Suicide Prevention Oversight Committee for Santa Clara County. In addition, he works locally with and across California, I would add, for the HERD Alliance, which is a suicide prevention organization based in Palo Alto. Among his many, many other contributions, we have worked with Dr. Joshi as a research partner, as well as working with many of the districts that he works with in Northern California. I could go on and on and on. I would like to note that despite the work that we've done together, neither Dr. Joshi nor Dr. Freeney have any commercial relationship to Cognito. I, of course, am an employee of Cognito, and we thank our panelists and everybody on the line again for joining us today. So let me transition first to Dr. Freeney to share a survey that she conducted right as schools were going out of real life into remote life in her service area around Houston with the Center for School Behavioral Health. And then after we hear from Dr. Freeney, we'll hear from Dr. Joshi, who will share with us some resources, both from the HERD Alliance as well as the American Academy of Pediatrics, and then we will take your questions. So I urge you to share your questions with us and hand it over to Dr. Freeney.
Thank you so much, Jennifer. Thank you for that warm welcome and for the opportunity to sit on this panel. Cognito has been doing such incredible work, and so it's a pleasure to be here with you all today. And I, again, just thank you for the invitation. And it's also an honor to be sitting alongside Dr. Joshi. So excited about the conversation today, and looking forward to questions and moving along in the behavioral health aspect of COVID-19. So just to give you a little bit of background about the needs assessment, the center works with, as Jennifer mentioned, we work collaboratively with a lot of youth serving organizations and school districts in the greater Houston area. And so as soon as the schools shut down and we were learning about just the pandemic and how the spread of it and just how serious it was, we knew that there were going to definitely be some behavioral health concerns. And so we wanted to start to understand what those were, what those emerging concerns were going to be, what some of the needs were. So the center and other community organizations around the area could support these needs and could funnel resources. And so to the school districts, to families, to students. And so we were able to have responses from 66 campus level administrators, mental health professionals, and teachers from 24 school districts in the greater Houston area. And one of the first things that we saw was that there was a really increased need for behavioral health education across the board, not only for students, but for parents, which emerged as that the top need was parents and caregivers, which is understandable given the fact that schools were closed, and then their childcare was an issue, unemployment became an issue, and so just with the additional stress on top of what was already underlying stressors, we know that the need is definitely was definitely there, and so. The center's been responding by providing webinars and developing free webinars that the school districts can utilize and share with their families as well. And so we see that even for educators and the school staff, that there's going to be continued need for behavioral health training and how to address some of these concerns with their students, and just how to help parents cope during this time. And then, of course, during the poll, we saw that there was a lot of planning going on. So this is a new area for a lot of people. And so it's just understanding from the behavioral health side, from our service side, what we can do to support the school districts. And we also learned that these a briefer version of trainings, virtual trainings, are what the these school districts identified as the most user-friendly at this time, just given all that they're juggling, trying to call students and trying to support their teachers and their other mental health professional staff, and helping to disseminate learning materials and getting students set up. So there's a lot of different things that were happening at one time. So that desired format was a very brief, brief topic focused format. And some of those top behavioral health needs that we saw were anxiety. I think anxiety has continued to be one of the top needs mental health needs that we're seeing across the board. And then of course, stress, coping strategies, dealing with isolation, and then continuing to support our parents. Next slide, please. And what we also found was that while districts were gearing up to support their students, they were finding multiple ways to reach their students. Some were doing those drive-by hellos, while others were making phone calls, and then some were already had platforms to set up virtually, virtual counseling, and especially to help those students that were already dealing with mental illness, to continue to seek counseling services to make sure that they were able to continue to get their medications and to keep them connected with their providers. So that was one of the concerns that was brought to light from this survey. And then we also asked them about the training topics. And so, of course, again, we see the need for stress and anxiety, information about what the signs and symptoms are and what that looks like. We know that a kindergartner or first grader displaying anxiety is going to look different from a high schooler that displays the anxiety. So just helping parents understand what that looks like, helping them put in home routines in order to help them stay safe, in order to answer their children's questions. And then, of course, making sure that parents understand that it's important for them to take care of themselves as well. You know, when we're on that airplane and they, you know, the oxygen mask drop down, they say, put your own oxygen mask on first before you help anybody else. And this is the same thing with with mental health. It's definitely important that we take care of ourselves so that we're able to care for others. And then, of course, in helping youth cope with COVID-19, so many questions. Some of our young people are asking very basic questions. Why can't I see my friends? Why do I have to stay at home? Why can't I go see my teachers? And so just helping them understand on their level that this is a need for safety, and reassuring them that eventually you will see your friends again, you will see your teachers again. And then with older students, asking them, how are you handling this? What are your thoughts? What are your feelings? So allowing them to share versus just telling them what's going on, or this is what's going to happen. So it's inviting them to be a part of that conversation. And then, of course, media right now is huge. We have social media, we have the Zoom and Skype where we're able to connect with friends and family, and then just this whole another concept of digital divide. Some individuals don't have access to internet to continue their education and learning. So just understanding that there are going to be there's effects that media has on mental health. And so we're developing webinars that talk about mass media, the safety around it, cyberbullying, what parents and how educators can look at what those things are and understand ways that they can still intercede and they can still look for those red flags, even though they're not in the presence of the child. And then, of course, what this webinar is all about is future concerns and transitioning back to the school system, and what is that going to look like, and how are we going to support those students when we're already stretched with resources. There are some school districts that are barely able to meet the behavioral health needs of their students just because of the lack of support that they have from counselors. So the lack of funding that they have for counseling and for staff. So just being short-staffed in that area is a concern. But there's definitely the need and desire to learn more from the school districts. They're concerned about their students, and so we're working together to make sure that we can meet those needs as best as possible.
Great. Thank you so much, Jamie. That's the amount of information you've been able to gather, and also a way to support your districts, 31 districts, is phenomenal. The work that you guys do and the rapidity with how you turn it around.
Thank you.
I want to turn now to Dr. Joshi. Shashank, are you?
Am I muted?
Now you're good.
No, I'm good. Hi, everybody. I'm Shashank Joshi, and I'm honored to be sharing this space, this digital space, with Dr. Freeney and with Jennifer Spiegler, and with you all, with the 700 or 800 of you on this. What I'd like to do is very briefly highlight some of the things that we have been doing here in California. I live in the Bay Area. My wife and I are raising 3 boys who are all in public school in various ages, from about to graduate to right in the middle of middle school to about to go to high school. So some of my experience is not only as a clinician and as a researcher, but also as a parent. I've been doing school mental health work for 21 years. And one of the most important things I'd like to highlight that Dr. Freeney just mentioned from her needs survey was the idea that I hope many of you have already started to practice, which is caring for yourselves and thinking about supporting parents in order to facilitate the engagement of the students in your district. And so I'm guessing the vast majority of you are in some sort of school health, school mental health, or school administrator capacity. And what Dr. Freeney mentioned around the oxygen mask metaphor, and some of you will be getting on planes again sometime soon, but we can think about that in our daily lives. And I found this really cool article in this class that we teach for Stanford undergrads. The class is called The Psychology of Stoked, and it's all about cultivating a life of well-being, learning about the neuroscience of the different components of well-being. And one of them has to do with gratitude and gratefulness. And so on the first resource here, 6 daily questions to ask yourself in quarantine, this comes from the Greater Good Science Center. That website is a trove of resources for all humans, but I find in particular for school mental health and school health professionals. And I'm just going to highlight a few of those. And this article was written by a Bay Area photojournalist, Brooke Anderson. And I think these themes resonate. The first one is, what am I grateful for today? And you know, one of the things that I think about in my life is just that, you know, not everyone has the privilege to shelter in place or do so safely with financial security. I'm guessing most of you on this call do. And sometimes it's just noticing the everyday, you know, like the ability to just get on this call right now and be in a safe place and be in a place that is maybe confidential. Well, a lot of our students who are engaging in mental health care, trying to get their support, don't have a confidential space. That's a question that may come up later on the chat. So I think having gratitude for when you go to the grocery store, or when you go to the clinic, or if you had your COVID test, for all the frontline workers. Number 2, who are you checking in on or connecting with today? So you might be checking in on a parent of yours, a long lost friend, a relative, or you might even be checking in with a member of your grade level team who you're worried about, who might be expressing some anxiety about what's going to happen to kind of bring this plane to a landing for this semester, and then planning for the fall. Number 3, what expectations of normal am I letting go of today? And that has to do in particular with my 3 teenage boys who are right now at home learning asynchronously, and like they don't need me or my wife there. We find that when we leave the house, they're way better able to do what they need to do. And normally I would feel like I need to be on top of all the things they're doing, but I've learned to move from being a manager to being a consultant, right? Because we've raised 3 teenagers. And so in particular, during times of COVID, we found that for some of our youth who are actually able to do some of the work, for parents, giving them permission to let go of trying to, you know, pounce on every detail, but maybe check in at the end of the week, maybe check in with a teacher where they're maybe struggling, and finding out some information that way. Number 4, how am I getting outside today? And as the states are moving to phase 2 and allowing for more outside activity with the proper precautions, with physical distancing while remaining socially connected, wearing masks, etc. I think schools are finding ways. For example, in California, there's planning now where we may have during a school week 2 days of on-site learning and 3 days of off-site learning. And that is going to allow for some in-person time and potentially for some connection with you all who are on the front line. And it's going to obviously depend on your locale. Number 5, how am I moving my body today? How am I exercising? I don't know about you all, I feel like I've gained 30 pounds in the last 6 weeks. And so something as simple as taking my bike to work has really been great. I mean, I've noticed that the flowers are in bloom here in California. The weather's been amazing. It's been rather ironic as we face the greatest crisis of the last 100 years. Nature is doing its work. Mother Nature in terms of COVID, but also nature is in full bloom right now. So Number 6, the last one, is finding beauty in just the everyday, the beauty you're noticing, the beauty maybe you're creating or cultivating, and inviting in and sharing that with your family. And we know that gratitude and the sharing of gratitude is infectious. If we're focusing on that and talking about it, if we're having a routine with our family around dinner, if you're having a family dinner 2 or 3 times a week, if you're sharing gratitude, it gets other people in the family to notice what they might be grateful for. And so in the worst times, we learn from people who've struggled the most. And all of these gratitude exercises and what am I grateful for, they often come from, for example, prisoners who've written about what helped them to survive under really terrible conditions. So that's the first resource. The second resource that I just want to highlight, and then I'm going to finish my comments by talking about the Academy of Pediatrics, which just came out with some guidelines. The second resource on your page right now is the California Surgeon General's Playbook. California has its first ever Surgeon General. It's Dr. Nadine Burke-Harris. And we knew she was a superstar when she was a pediatrics resident here some time ago, and now she's become our Surgeon General. And she sent this out to the entire state. I thought it was great to put on as a resource here for you all. Many of you are not in California, but it basically breaks down 6 stress busting strategies, which are going to feel a little bit like common wisdom. But what I really like that she did is she breaks it down and helps you to work your own program. And these are super simple, everyday things you can do. Again, thinking about your own stress relief so you can help your students, so you can help the ancillary staff, so you can help your grade level teams. And maybe if you're a teacher, you can help your assistant principal or principal who might come to you as their main coaches, maybe behind the scenes for their own well-being. So I wanted to highlight that. San Diego County Office of Ed, I know we've got some San Diego County folks in the house today. I wanted to highlight their Team Guide to Mental Health and Wellness. It's really well done. It's just a beautiful flyer that you can use and adapt for your own county. It's really got very nice colors. It's very appealing, and it's just a list of resources, followed by shareable resources from various national organizations. The National Center for School Mental Health, some of you hopefully know that resource. There's some really great highlighted resources from, for example, on that site from the National Association of School Psychologists. How do we balance virtual teaching and supporting the mental health of our students and learners virtually? You know, bringing up the idea that mental health is part of overall health and we have to be healthy enough to learn. On the next slide, the Academy of Pediatrics put together these COVID-19 mental health guidelines that came out of the COVID-19 reentry plan. This was just published yesterday evening. And I'm on the Council of School Health for AAP. So I wanted to just highlight this as a resource. We're at 11:30. So I'm just going to highlight this and you'll be able to see it. 2 of the points I just want to bring your attention to in the middle. Schools are encouraged to contact students who do not return to school in the fall, as they may be experiencing school avoidance due to anxiety related to the pandemic. And that may be anxiety about not being sure if their school is going to be safe, anxiety from what they're hearing their parents or siblings talk about, anxiety around what they're seeing on TV. So I think you all have those students who are on your radar who you're going to be checking in with. But those of you who work in middle school with 6th graders or in high school with 9th graders, you may not know who those kids are yet. And so there, I think making sure you're paying attention to those who are on the roster but who are not showing up for the first sessions. You want to equip your school staff to know and let you know, okay, we're missing a couple of kids have been absent for the first 2 or 3 days. Let's find a system to check on these kids. And then the next one is schools should be attuned to the broader social and family stressors that may affect a student's ability to attend school. Not only not having Wi-Fi access, but also really just dealing with the stress of your parents not having a job or not being able to get the meals that they would normally get. Hopefully when the school year starts, they will have that, but they may go through a summer where they're not having access to some of the basic requirements they need to be healthy enough to learn. So they may come into the fall maybe not as ready to engage as learners for a variety of things that are outside our control. The very last thing I'll lead you with is the thing that you can do today when this call is done is you can empower the parents and your stakeholders who know that mental health is a crucial part of overall health and the students have to be healthy enough to learn. Find out when your last school board meeting is. Here in Palo Alto Unified School District in Northern California, it's actually tonight. And we have a small army of student advocates and students and graduates who are going to show up and talk about how important it is to maintain mental health funding for the on-site school support, for the counselors, for the people who come in through intern programs, because we know from Dr. Freeney's work, and she just armed you with some data to talk about this needs assessment from a community to show that we know behavioral health needs are going to be increasing, not decreasing. So even in the financial stressful times of COVID, now is not the time to be reducing services and supports for our students. And that's something that the parents and students are going to be broadcasting loud and proud in their 3 minutes of fame today at the school board meeting. So find out when yours are and make sure that you're getting your people to those meetings, including yourselves. They're probably going to be virtual, but that's something you can do to really empower mental health in schools as we think about the return. And I'll stop there.
I have to say thank you so much, both of you, and Dr. Joshi. I think that that's really important that, you know, on this series of calls, we've talked so much about student mental health, but not looking at the public policy side and the funding side and how to help people feel more empowered in this time by really making their voices heard. I think that that's really crucial. So I would join you in encouraging people to really focus on that. I think in this series of webinars that we've done, we've talked a lot about how some districts had really in the beginning prioritized the academics over the social and emotional well-being of students. And so I think that's a really crucial thing to take back. So we have several questions and let's get to them. The first one is, how should mental health providers prioritize services to students on campus? Has anyone developed screening tools to assess the severity of trauma from the pandemic and have recommendations for those who are seriously impacted versus those who just need a little extra support? And what will this look like for school counseling programs? And I think, Dr. Joshi, can I send that to you first? Is that okay?
Sure, and then maybe Dr. Freeney will have some thoughts based on the kind of real world experience of having been through 2 hurricanes, et cetera, in Houston. I'm just going to highlight a resource that I think is going to be giving us some more specific ideas. And that is my go-to resource for anything related to child trauma in the schools and engagement with educators as well as with kids. And that's the National Child Traumatic Stress Network, NCTSN. And that is on our resource page. It's sort of embedded in one of the links, but perhaps, Jennifer, that can also be sent out along with the full American Academy of Pediatrics return to in-person education in schools reference. So it's, I know most of you know this, or many of you know this resource, NCTSN, National Child Traumatic Stress Network. And I would go to them around, you know, what is the difference between a brief check-in for some of the kids who are already on your radar, and for those for whom you might ask a couple of screening questions about just how it's been for them during COVID, and you know, what are their hopes and what are their worries about starting a new school year. And I think from there, you can build in based on how many kids you have, right, for the in-person versus the virtual. There are going to be many kids who are anxious, who are actually doing fine right now because they don't have to come to school. The kids who are school avoidant are actually doing great, as many of you know. And as we get closer to having in-person school, some of their anxieties may go up. Some of the kids who've had PTSD or who've been sub-threshold, but who've gone through some trauma and loss right now, And I think this was also on Dr. Freeney's slides, you may see them, you may see their symptoms go up. So I like that resource from the NCTSN, and I would be checking that over the coming 3 to 4 weeks, because I think they're going to be helping us for preparing for the fall.
Great. Dr. Freeney.
Dr. Freeney.
Sure. Just a comment about thinking of this from a lens of equity and understanding that some students will have more needs. When I say more needs, meaning they may not have access or as much access to healthcare or to the counseling needs or their pediatricians, and then transportation, and just all these social determinants of health that really feed into a person's ability to get the resources that they need and to thrive. And so as we're thinking about returning back to school and supporting students, just understanding that there may be some flexibility that we need to consider in order to really meet the needs of all students. And just understanding too, as Dr. Josie just eloquently put, that when working with students, there's going to be some that have a higher need or already at risk, that may need more of a crisis intervention versus those that have maybe a kind of a foundational level of just general anxiety. And so understanding that it's important to look across the spectrum and just be compassionate when working with families and students.
Great. I want to go back to Maria's original poll at the top of this call. Does it concern you that that only 2% of respondents felt that they were very well prepared for the return to school, that 54% said they're somewhat prepared, and a portion said that they were unsure, but between those who felt somewhat unprepared and very unprepared, it was 76% of the folks on this call. Do you think that's a national representative number?
Sure, I think it is, in that we are still in the midst of this pandemic, right? So while some school districts were probably further ahead already, just given other disasters such as hurricanes, for instance, here in Houston, or even traumatic events like school shootings and things like that. So there may be some protocol already in place that may put some school districts ahead of others, but I am optimistic in that our school districts are really prioritizing the need of students and families and understanding and value the mental health aspect of achievement. And so I do expect over time, especially over the summer, when there's less attention to academics and getting computers and laptops and internet out to students, that there'll be more time to focus on what that transition and the planning component of what that will look like when we come back to the school district.
Dr. Joshi?
Yeah, and I'll just say briefly that you all as school health professionals, you are key in shaping the message that the families right now are hearing. And a lot of our kids are they're gonna take the lead from how their parents are responding to what kind of messaging is going out from the district. There are some superintendents, like in our district, who are very active, and they've got a weekly meeting. It's called Backstage with the Superintendent, and he's broadcasting from his home office, and it actually gives you a different sense of who this person is. And I think it's nice for parents to be able to see the superintendent and the board members as humans who are doing this work behind the scenes. But in terms of the messages they're sending out, being proactive about school reentry, and talking about, hey, we are aware that this is not going to be usual. This is like a new normal, but you know, we are made up of parents. We as a school board are made up of parents. We as school leadership, we have parents here, or we have raised young adults. And so we understand that there's a lot of uncertainty. We're going to try to take as much of the uncertainty out in an age of uncertainty. And so I think this proactive messaging is really a good practice. And so the fact that 2% said we're fully capable and fully ready, I was impressed it was that high. I mean, like, you know, Dr. Freeney just said, like, we're in the midst of it right now. I think it's hard to know what we're going to look like in the fall. But hey, for those 2%, let Jennifer know who you are so we can get you on the next call so that we can be learning from what your districts are doing. One of the most beautiful things I've been able to be part of is this Herd Alliance K-12 toolkit for mental health promotion and suicide prevention. The Herd Alliance it loosely is an acronym for Healthcare Alliance in Response to Adolescent Depression and Related Conditions. It started here in the Bay Area when we had a series of tragedies. We had a number of youth suicides, and we came together as a mental health community, primary care, and schools to put together the best practice convening document to bring everything together. And we had about 120 pages worth of stuff for health promotion, but in particular when you're in crisis mode and you know, when there's a tragedy, to be ready for what to access. And now it's going into the 3rd edition. It's more than 300 pages. It lives online under the Herd K-12 toolkit. It's one of the resources on the page. And the biggest explosion we had was from our community partners who expanded the health promotion and really social emotional learning section. So the elementary and middle school, how do you build capacity for these kids to really be caring for one another? Highlighting the idea that kindness is the norm. We all learn in different ways. We all deal with COVID in different ways. Our families are coming from different walks of life. You know, and when you're in one school, you really can say we're all in this together. We're in the same boat because we go to this school. But even within a school, you may have some people who are not in this exactly in the same boat. Some come to school in an ocean liner, and others are coming in a dinghy, and some are floating on a raft, and school is the sanctuary. And so again, being prepared for understanding that just because the students are all here doesn't mean that they're all okay in the same way. Some of them may really be struggling, but you know, getting to school can be sanctuary. So for those of you who posed the question around, like, how are we going to support this diverse array of students, there's not a simple answer for that. Just know that for many of our students, being online, you know, virtually, or actually getting to come to school, even though we're not sure exactly what it's going to look like, that by itself can be sanctuary for some of our kids. Just being there with their peers, with their trusted adults, with you all on this call, that is going to be an opportunity for you all. You don't have to absolutely have everything solved, but you do have to be ready for what's going to come in the door that first week, because it's not going to be the same for all kids.
Thank you. Thank you both. Okay, let's go to another question. Do you have any suggestions for caring for the mental health needs of younger children or those with intellectual disabilities who may not understand why, when we return to school, we have masks and social distancing? And I would add to that schedules where maybe not all the kids are going to be with their friends because they're going back in stages or in staggered schedules. So how do we help those families? Dr. Green.
I can offer a little insight, and then I'm going to toss that right on over to Dr. Joshi to answer that question. But just understanding that when we're talking about younger children, that their show or behavior or I guess their display of concern may look a little different. So just being observant and being present and reassuring and answering their questions, we're likely to see some increased in like clinginess. So with younger students and children not really understanding why they've been in the house this long, and now all of a sudden we can go back out. You know, is my parent going to be safe? Or my sisters and brothers going to be safe? And while I'm, you know, excited to see my friends. Well, yesterday I couldn't play with my friend across the street, but all of a sudden today I can, and I can't see anything that's visually changed. So just understanding that when there are some signs and symptoms like not playing, loss of interest in some of the things that they were originally interested in, changes in appetite, of course, pain is another way that some of these mental illness symptoms manifest. So just being aware and helping parents understand that and acknowledge that that these things are okay, to help normalize some of this. And then just again trying to have some sort of a set schedule. So children really like stability. So if there are transitions, then transitioning and making routines out of things and involving them in those questions and in those discussions. Dr. Josie?
Yeah, so I would just add that, again, there are some resources out there that can guide your conversation. I believe the question asked about those who may have particular learning needs, those who may have intellectual differences or disabilities, those who may be on IEPs, those who may not understand, and also with younger children, the language you use to explain this is going to be different. So I would just say two things. One, it is likely that before schools open in whatever way they're going to in the fall, there will be a gradual reopening, and it's probably already starting in your communities. So I do think it's important for younger kids and for those who may not fully understand why people are wearing masks, for the parent to be the lead where possible, or whomever the caregiver is. So if the caregiver is wearing a mask when they go outside, they may be explaining why do we wear a mask when we go shopping, when we go grocery, or when we go to the park, why are we wearing a mask now? So they have a context. So it's not going to be that different when you go to school. It's unlikely that it's just going to overnight they're going to be out going to school with a mask. It's like they're going to be in public now over the next couple of months, and they're going to start to practice being back with their back in their life, back in their community, but in a way that is physically distanced while still being socially connected, so that they can gradually begin to do some of the things that they were doing before. I think it's important for the parents to model the masking. So even if our president doesn't mask some of the time, or really any of the time, I don't think I've ever seen him wear a mask. I think that parents, and if you're in states where you don't have a public health officer who can give you specific guidance about here's what it's going to look like, here's what you should be doing. I mean, hopefully you have that from your county public health department. If you don't have a principal who ascribes to that, then you may have to go back to the CDC guidelines, or in particular the public health, hopefully in your county, is providing these kinds of guidelines. If your district is not providing the guideline, take a guideline from a place where you feel like, okay, this is best practice to get people outside and get them prepared for what's going to happen. Another resource I really like that I found online is from PBS, and it's just the 10 tips for talking about COVID-19 with your kids. It was written by Wendy Russell. It came out just a couple days ago on May 14th. And it's really nice. It starts with very simple, it's just on pbs.org, making children feel safe. They first talk about, it's not only COVID-19, it's the anxiety about COVID-19. So I think for all of us on this call, it's not only about, is our curve's going to continue to flatten, and as we open up slightly, are we going to turn into, the Jacksonville, Florida beaches a month ago? Not to cap on Jacksonville, but I do have family there. And my cousin is actually, Dr. Sunil Joshi is the guy who comes on at night and tells the community about like what they should and shouldn't be doing. He's an immunologist. And they just exploded. Everyone was out at the beaches a month ago. They haven't even reached the peak of their curve. And we hope that doesn't happen, right? Around communities, that people will follow the guidelines and go outside and not raise more anxiety about like what the other person's doing. So I like how it gets you through on this particular list, talking about the facts, letting them ask questions, leading a discussion. And when it comes to those who may not understand, keeping it simple, keeping it very straightforward. We're going to be doing this when we go outside, and this is what's going to happen in school too. When you come in, someone's going to take your temperature. It's not going to be in your mouth. It's not a shot. It's just they put a little thing outside your head, and it's going to tell them if you can be in school. We're going to wear a mask. We're going to sanitize, and that's so that we can be in school safely, because we still have this virus with us, and we're all concerned about each other's health and safety. You know, really simple, basic points, so that when they get to school, it's like, well, they already would have had some practice during the summer.
That's great advice. Here's the next question. It's a little long, so it's in two parts. As a school counselor, how can I prepare teachers who are feeling anxious about students returning to school? Some of these teachers are anxious themselves, and some are worried that students will come in with high anxiety in regards to the virus. What are some specific questions teachers can ask to start conversations with students that can support students' social emotional well-being? This question is specific to students in kindergarten to 4th grade.
Well, I'm going to start by answering that question by promoting Cognito's amazing virtual trainings on trauma. I think it's great that you're thinking about teachers and the ancillary staff at schools. And I think there's going to definitely be need for trauma training, helping them understand adolescent and child mental health and brain development, some key pointers around that, and then providing them with some key question and answer, a key question and answer sheet, or something that will make it easy to help their anxiety subside around having these conversations. And just to make sure that the message is standard across the school, everyone from the bus drivers to the lunchroom staff to the teachers, anybody that the child may come in contact with, it's important for them to be armed with that information. And so sharing some of that training material that is usually utilized by mental health professionals, sharing that with teachers and helping them to, because they're going to be frontline as well, helping them to recognize some of those signs and symptoms and make referrals, but also arming them with responses to some of these common questions, and then reassuring them that if you're uncomfortable answering certain questions, or if you're uncomfortable not saying certain things or with the language, making sure that they have that ability to come back to you or to come back to somebody in the school to share that and not be penalized for it, but just to get help them to feel comfortable asking for help, because this is going to be very new for all of us. But I certainly would promote social emotional learning training, any training opportunities to share those with teachers, because again, they're going to be the ones sitting in the classroom with the students majority of the day and fielding those questions. So certainly understand why there is a level of anxiety, but again, just being there to provide them with some of the tools that they may need.
Great. Dr.
Yeah,
Joshi?
and I'll just add, just highlight what Dr. Freeney said, and add that on that pbs.org resource, there's a really nice video that there's a group called Brain Pop that puts out really cool educational resources. And they put out a great video about viruses and what they are for young children, and also has some nice kind of clues on specific words that parents can use, but I think teachers can use. I would go back to those 10 things about talking to your kids about COVID-19. I think that would be very useful for elementary school teachers to be engaging the younger and sort of the 10 and under group around the discussion. really keeping it simple, understanding what their questions might be. There might even be, some kind of, question and answer in the very beginning, the weeks leading up to school, so that the teachers maybe can proactively send some messaging out to the parents in their classrooms. Again, I think this would be put at the feet of the grade level teams of schools that want to do that. But I think to kind of head off some of the teacher anxiety and counselor anxiety, if some questions can go out, it's almost like a mini needs assessment, similar to what Dr. Freeney highlighted. It's, well, what's the needs assessment from the parents? At the end of the school year, we get a little sheet to fill out about our student, our child, what did they find helpful this year? What will they find helpful next year? Are there any specific needs that we should be aware of? I think similarly, a same kind of questionnaire could go out from a district. It could be very brief. Does your child have any needs we should be aware of, or any specific questions? Do you have any questions? So that the grade level teams and the counselors can know, okay, this is on the mind of our parents. And maybe it's around safety, and maybe it's around routine, and we don't exactly have all the answers yet, but at least you know what your learners and the parents of your learners are coming in with. And I think one of the really nice pieces about this article also is there's a lot around empathy. There's a lot about the teachers really just trying to understand where the kids are coming from, not necessarily having all the answers, but really just hearing what's on the kids' minds, so that they can then, in a very simple way, reassure them that you're in school, we're all really glad to be back together, we're going to do this in a safe way, and we understand that there's still a lot of things we don't know about how this is all going to, maybe in the middle of the year there's a surge and they have to close back down. That's not really in anyone's control. However, what you do have is, when you're in school, we're going to wear our masks, we're going to be gelling in and gelling out, we're going to be learning and having fun together, but we're going to be doing it in a different way, and we're going to get through it together. I think those messages of good listening and good empathy are going to be helpful, not only for parents, but for all levels of school staff.
And I wanted to quickly add to that many of children are going to be experiencing separation and or grief from either having parents that served as essential personnel, or maybe someone that they lost due to the coronavirus. So equipping teachers, there's a wonderful resource on the National Child Traumatic Stress Network on separation and grief and trauma related to COVID-19 that would be useful, I think, for student or for teachers and for mental health professionals.
Well, I want to note that we're almost at time, so I think those were really great places to wrap up. I want to say to everybody on the call that oops, my phone is making noise, that we will send the slides out. We have captured a few more resources from the comments that we have had here, so everybody will get everything. My team has promised 24-hour turnaround, so hope we can make good on that. Thank you both for joining us, and for the hundreds of people across the country who were on this call today.
Thank you very much. Thank you, Dr.
Thank
Freeney.
you. It's a pleasure.
Thank you, Jen.
Thank you very much, and thanks to the Cognito team. And this is a wrap.
Thank you.
Take care.
Bye.
Take care. I can't figure out how to leave.